Hello everyone, this is Realika, your student nurse from Medical Colleges of Northern Philippines. For today's video, I'll be performing how to properly assess the integumentary system, which is the skin, hair, and nails of the patient. So without further ado, let's get started. So first is identify the patient. Second is the purpose of the integumentary examination and answer any question. Good day po, ma'am. I'm Realika and I'm your student nurse for today po, ma'am. Verification lang po, ma'am, no? May I know your name po, ma'am?
I'm Realika.
How about your birthday po, ma'am?
March 20, 2004.
Okay. How old are you na po?
I'm 8 years old po.
Okay. So, for today's ma'am, I'll be assessing your integumentary system, which is your skin, hair, and nails. And for me to able to assess those parts, ma'am, can I ask a consent po if pwede ko po hawakan yung mga certain parts ng body nyo po?
Opo.
Okay po, ma'am. What language is comfortable with you po, ma'am? Is it Tagalog or English po?
Tagalog po.
So, okay, ma'am. So, rest assured na that all the documents or findings na are completely confidential with me and the attending physician that I will be referring to you. Is it okay to you, ma'am?
Opo.
So, ma'am, kung nagtataka po kayo kung bakit po namin ginagawa ito, para po malaman namin if everything is normal or if there are any abnormalities of your skin like skin lesion, skin coloration. We need to take note of them to prevent and further complication. May katanungan po ba kayo, ma'am?
Wala po.
Okay, ma'am, but before I'll start po, I'll just have a quick history about you po, ma'am, no? Kailan po ba yun?
Yes.
So, ma'am, how your current symptoms po? Meron po ba kayong skin problem like rashes or skin lesions po?
Wala naman po.
Okay po, ma'am. How about your dryness of skin po? Meron po ba kayong dryness of skin or oily po?
Wala naman po.
Okay. How about your bruising po, ma'am? Or pagpapasa ng inyong skin po?
Wala naman po.
Okay, ma'am. Do you have any changes in lesion appearance po, ma'am?
Wala po.
How about sa hair po, ma'am? May hair loss po ba tayo?
Wala po.
Okay po. Sa nail po, ma'am, any changes po, ma'am?
Wala.
Sa previous history po, ma'am, may previous problem po ba sa skin?
Wala.
Sa hair po, ma'am?
Wala.
And nails po, ma'am? Meron po ba, ma'am?
Wala.
Okay, ma'am. How about allergic po sa allergic reaction po sa food or medicine po, ma'am? Meron po ba, ma'am?
Wala po.
Okay, ma'am. Ask the patient to remove all clothing and put on an examination gown if appropriate. The patient remains in the sitting position for most of the examination but will need to stand or lie on the side bed when the posterior part of the body is examined, exposing only the body part of being examined. Then perform hand hygiene. So, assuming that the patient is wearing the examination gown, close the curtains to provide privacy of the patient. So, I already told the patient to change her clothes into patient gown, and I already provided the privacy of her. So now, I'll be starting the assessment, but before that, I'll be wearing a gloves. Wait lang po, ma'am. Magsusuot lang po ako ng gloves. Inspect the overall skin coloration. Inspect for vascularity, bleeding, or bruising. And inspect the skin for lesion. Note the bruises, scratches, cuts. Inspect bites and wounds. If present, note the size, the shape, the color, exudates, and distribution or pattern. So, ma'am, pwede po bang pakiganyan lang po yung kamay natin po? Okay po, baba na po. So, ma'am, the skin color ranges from light to brown, which means normal po, and there is no skin lesion. Palpate the skin, the back of your hand to assess temperature. Wear gloves when palpating any potentially open area of the skin. So why the back of our hands? We use this because this is the more sensitive temperature of our hands. So ma'am, will you please do this po? Okay po. Ma'am, I observed po na that hindi naman po masyadong mainit or oily po yung skin nyo. Moist lang po, and that's good to know po, ma'am. So next, assess for the skin turgor, gently pinching the skin under the clavicle. So ma'am, itouch ko lang po dito sa part niyo po, ma'am, no? So, ma'am, sa baba naman po for edema po, no? Sa kabila naman po, ma'am. Okay po, ma'am. So, ma'am, I observed that there are no presence of edema po, no? Nung hiniwakan ko po yung legs nyo and feet nyo, bumalik naman po siya agad. Hindi naman po siya nag-indent nung pinunch ko din po yung under sa clavicle nyo po para sa skin turgor. Meron naman po siyang mobility and bumalik din naman po siya agad. Then, I observed that your skin is quite thick din po, and that's good po. For the next part of the assessment po, I'll be inspecting your hair po. Okay, sa likod naman po, ma'am. Okay po. So, ma'am, ang next naman po na gagawin ko, yung nails niyo po, ma'am. Patingin po ng nails po. wala naman po, ma'am. Okay, ma'am, I observed that your nails are quite groomed and it's clean po, and pink tones din po yung nails natin, and nakadikit naman po siya, wala din po pong nakaangat. Next naman po, ma'am, I'll pinch lang this po. Okay po, ma'am. Ayun po, ma'am. Na-observe ko po sa capillary refill nyo po na bumalik naman po agad ang pagka-pink tones ng ating nails nung freeness at rinalis ko po. And that's good na sign po para sa ating nails po, ma'am. So, ma'am, ito na po yung last na assessment natin. Maganda naman po lahat ang nangyari sa ating assessment. Thank you so much po, ma'am, for your cooperation and any clarification or concern po, ma'am. Sige, thank you po, ma'am.